Hi everyone, Dr. Benedetto here again this week with a quick health video, educational video. Hopefully everybody's enjoying these. We're going to dive right in today. Kind of like the one we did last week with anxiety, I got another request for this week on a topic which was type 1 diabetes. Okay, we're going to talk. And so I figured, let me just do a quick video on diabetes in general, right? Because everybody pretty much at this point knows there's two types, maybe a third. We'll talk about that in one sec. Maybe, but there's two types, type 1 and type 2, okay? Let's take each of them and then what they are, how you get them, what you can do about them, okay? Type 1 diabetes, okay? Type 1 diabetes is an autoimmune disease. So an autoimmune disease is when your immune system attacks part of you and damages the tissue. In type 1 diabetes, that happens to the pancreas, right? So immune system attacks pancreas doesn't work, now I need to take insulin, okay? So that's a little bit of a different animal than type 2. Type 1 diabetes is not as common, not nearly as common. And type 2 diabetes is much more common. So type 2 diabetes is the majority of cases of diabetes in this country, and that is purely brought on by lifestyle, right? So everybody, I'm sure, knows at this time, type 2 diabetes, poor lifestyle, sedentary lifestyle, poor diet, all these things will catch up to you typically later in life, middle age on, and now you have diabetes. Your pancreas is still making insulin. You've developed resistance to that insulin, so the blood sugar and the insulin aren't getting where they need to go. So either way, diabetes in general, again, most of it's type 2, is a huge burden on our medical system because there's lots of complications, heart disease, eye problems, you name it, kidney problems, a huge burden. A lot of chronic illness stems from diabetes, and it's really taxing our medical system. So what can you do, right? First of all, how do you develop it? Obviously, we just went over that. Type 1 diabetes, autoimmune disease, you get it. Type 2 diabetes is completely the individual's fault, to be honest with you. They brought it on themselves. So what do you do about it? You can keep taking the medications that you're given, which many times don't work. Really quick story about a patient. This is unfortunately how these things are treated in our medical system, which is why it's a problem. I had one patient tell me was diagnosed with type 1 diabetes, went to their doctor, and their doctor said, just take your insulin, you'll be fine. And this patient was like, wait, shouldn't I change my diet? Should I be exercising? Like, should I be doing something else? Nope, eat whatever you want, make sure you take your insulin. Mind blown. Some things I'm not surprised by much anymore in our medical system, but that's insanity. That's insane. So what can you do? So for both of these, dietary changes are a must, right? I mean, you have to remove the carbohydrates, the refined sugars, these things, the artificial sweeteners, they have to come out of the diet. Okay, right? So you have to eat a more paleo type diet, right? High in fats, high in proteins, high in vegetables and things like that. Fruits are okay, but we want to get all the processed foods, all the refined carbohydrates out of the diet. It's a must. It's an absolute must, okay? And there's some supplementation and things like that we can do along the way. But it's not, should I do this? It's, you must do this. You have to do this, okay, if you have diabetes. And they're the same for both. If you have type 1 diabetes and it's an autoimmune disease, we put patients on an autoimmune diet or an anti-inflammatory diet. Type 2 diabetics should be on the same diet. So, now, I briefly referred to that there may be another kind. It's starting to show up in the literature now. It's type 3 diabetes. Type 3 diabetes is kind of what's being referred to, like I said, starting to show up in the research as type 3 diabetes is Alzheimer's disease. So a lot of these chronic neurological degenerative disorders, dementia and Alzheimer's, because we're finding very high levels and issues with insulin in Alzheimer's patients, meaning that they're having problems with insulin, they're having problems with blood sugar, and it's contributing to the brain damage. If we needed another reason to control our blood sugar, right? So crucial, whether you have diabetes or not. We don't even have time on this video to go into pre-diabetes. Maybe I'll do that in the next one. What's pre-diabetes? But there's tens of millions of people walking around out there that are just diabetes waiting to happen. So it's only a matter of time. It's a ticking time bomb. So those are your kind of basic differences. Treatments are the same. Obviously, if you have type 1 diabetes, you will be taking insulin. Even some of my patients with type 2 diabetes are taking insulin because it's gotten so bad. But type 2 diabetes is completely reversible. But you got to do the work. You know, it doesn't happen by taking a pill. Type 1 diabetes, it's an autoimmune disease. You have it. Yes, you need to take your insulin, but then you need to do these other things from a diet nutritional standpoint too that will help to make the insulin more effective and to help stop the progression of the autoimmune disease. So I know we blew through a lot of this pretty quick. Wanted to go over basic differences and some things that can be done, things that you've heard me preach before. If you have any questions, please ask. Comment below or reply to this email if you're getting it on email or you're seeing it on YouTube channel or whatever. If you like this information, please give it a thumbs up. Share it with whoever needs to know it. If no doubt you know people, probably more than one, that have some form of diabetes or blood sugar problems, and they may want more information. If you have questions or anything and you would like to know more about what to do specifically, just reach out to us. We're here. So hopefully this was helpful today. Again, if you have any additional questions or comments, we are here for you. So everyone have a terrific day, and we'll see you on the next video.